Good morning and welcome to our panel discussion this morning on peace and sustainable health development, prioritizing health in times of war and conflict. It's my great honor and pleasure to host you this morning, and thank you very much for selecting to be in this panel. My name is Amir Takian. I am professor and founding director of the Center of Excellence for Global Health at Tehran University of Medical Sciences in Iran, and a member of the executive committee of the World Health Summit. This session is supported by Tehran University of Medical Sciences and the WHS Academic Alliance. Health and peace are interrelated, and the relationship between violence and human well-being is complex and multifaceted. There cannot be health without peace, and there cannot be peace without health. As the Director General of the World Health Organization said, health is the driver of peace for sustainable development, and war and conflict may lead to the disruption of health systems, the collapse of essential medical care supply chain, and the exit of healthcare workers, attacks on healthcare professionals, and ultimately impacting the life and the livelihoods of the citizens. The collapse of health systems disproportionately affects the vulnerable population, including pregnant women, children, and displaced and elderly. The impact of war extends beyond communicable diseases, and healthcare for non-communicable diseases such as diabetes, cancer, and cardiovascular conditions is often disrupted, leading to the consequences which are equally severe, with prolonged exposure to violence causing widespread psychological disorders and mental health, including post-traumatic stress disorder, depression, and anxiety. Women of reproductive age living near high-density conflict experience mortality rates 3 times higher than the people in peaceful settings. Furthermore, conflict generates severe food security, malnutrition, and famine, which contributes to deteriorating health outcomes, particularly among vulnerable groups such as women and children. Colleagues, ladies and gentlemen, recent trends highlight a resurgence in organized violence and internationalized interstate conflicts. In 2023, a record of 59 state-based conflicts were documented across 34 countries, alongside 75 non-state conflicts, resulting in unprecedented levels of displacement and a public health crisis. These conflicts have driven unprecedented levels of displacement, with over 122 million people classified as forcibly displaced people as of mid-2024, and 16 countries reporting that more than 5% of their population have been forcibly displaced. In recent years, the persistent occurrence of armed conflicts, specifically in fragile regions, has caused significant public health crises. The lethality of contemporary conflict has escalated dramatically, with battle-related deaths reaching their highest levels since 1984. Overall, fatalities from organized violence surged by 97% from 2021 to 2022, making 2022 the deadliest year since the Rwandan genocide in 1994. In 2022, over 204,000 fatalities were reported, primarily attributed to the wars in Ethiopia and Ukraine. Since October 2023, over 70,000 civilians, including 20,000 children, many healthcare workers, UN staff, and journalists have been killed in Gaza. Now, ceasefire has been signed a few days back, but continuing conflict has devastated the health system, with repeated attacks on hospital and primary healthcare centers, reducing functional capacity to below 30%, and primary healthcare reducing functional capacity, and triggering a surge in fatalities from both direct violent injuries and indirectly from deteriorated chronic disease management. Simultaneously, Sudan's protracted armed conflict has left less than 1/3 of hospitals operational in conflict zones, while the forced militarization of remaining facilities, crippling shortages of medical supplies and personnel, and massive internal displacements has elevated fatality rates well above normal rates. In Yemen, now we are witnessing the prolonged and the most devastating cholera epidemic there, and resistance to antibiotics, TB, and other things returning. Overall, these countries experience a compounded crisis where the breakdown in healthcare services not only increases direct combat-related deaths, but also fosters a secondary wave of mortality due to disrupted primary care and heightened vulnerability to infectious and chronic diseases. The World Health Organization Constitution recognizes that the health of all people is fundamental to the attainment of peace and security. Further, It contributes to proactive protection of health resources by communities. Conflict profoundly affects public health, showing the detrimental impact of women and children who are often on the highest risk. Addressing the health challenges posed by conflict requires coordinated, innovating, and adaptive strategies. Sustainable Development Goal 3 recognizes that risks to health and well-being are significantly aggravated in settings affected by war, conflict, and other forms of organized violence, which also have significant negative effects on mental health. By prioritizing health in conflict setting, we can lay the foundation for more resilient and healthier communities in the post-conflict period, ultimately contributing to international peace building and conflict resolution. We need to promote resilient, conflict-responsive health system to ensure that interventions support both health outcome and peace building. Now, this panel. This panel is in continuity of the panel that we had last year in the World Health Summit, and we discussed about how we can actually prioritize health during war and conflict. All of us are witnessing how violent and uncertain the world is becoming. And now I think the global health community and the World Health Summit in particular has the responsibility to address that. Our main message is very simple, rather practical. We need to prioritize health during the war and conflict because peace without health is impossible. Today, I'm so privileged to have my co-panelists from different organizations and different settings, and I'm so pleased and privileged to have the lineup of these lovely speakers. Their resume and the CV is very long, is on the website, and you have seen that, so I don't want to go to that. But we have 3 sets of interventions by them, and we have 2 sets of episodes that you can share with us your experiences and ask the question. I come to that. For the first round, it's about 6 minutes each, and I would like to begin with Catherine Jacobsdottir. Catherine is known for all of us. She has been the Prime Minister of Iceland, the country who is very famous and one of the most peaceful places to live on this planet. And Iceland has been quite fundamental in contributing to the peace worldwide as well. So who better than Catherine who can share with us some experiences? And I would like to ask Catherine to say something about peace. What's peace? And why it matters. She has been leading a country, and now in the capacity of the very experienced politician, I would like to ask Catherine to share with us some experiences, how we can call peace and why it matters. Thank you very much.
Thank you, Amir, and thank you for setting the scene in this very clear and concise way, because it's true that we are living, as we have been talking about in all our panels, in a fragmented world where we see the rise of conflicts, where we see the rise of militarism, increased military spending, which obviously also has an effect on other issues like health spending. So we are also seeing this increase in attacks on health workers, on the infrastructure of health, which is something that we had agreed on not to be doing, even though there is a war. So we are seeing even more fragmentation in areas where there is war and conflict. And you mentioned some of those places: Gaza, Sudan, Yemen, Ukraine, and I could name many more. But this is the world we are seeing right now. And you mentioned that I come from Iceland. Yes, the most peaceful country in the world, maybe because we're so far away, maybe because we're an island far away, maybe it's just a coincidence, but we have a very peaceful history. We had a civil war in Iceland in the 13th century, and since then it's been quite a peaceful country. We are an island between North America and Europe, and because of that, we actually sometimes have been used, not least during the era of Cold War, to be a meeting place between Russia, back then the Soviet Union, and the US. So in the 70s we had the chess fight between Fischer and Spassky, and in the 80s we had the meeting between Reagan and Gorbachev, which actually laid the grounds to end the Cold War. So we have been, maybe because we're small, we're an island, we're relatively far away, so we have, yes, been in peace, but I also think it's more complicated. When we became an republic, an independent republic, it took many years, it took decades. but there was never any question of any violence. This was a history of complicated negotiations with the Kingdom of Denmark, which we belong to, and nobody ever thought about solving that conflict except with negotiations. So that is interesting in itself. Now, I could talk a lot about the fact that we spend a lot more time and a lot more efforts and a lot more budget into talking about war and conflicts than peace. And actually, I think it's a lot easier to start a war and a conflict than to solve a war and a conflict, not to mention to maintain peace, which is a constant, which is kind of a constant project, because what is peace? You ask a very big question here in the beginning, Amir, different perspectives on peace and its relation with health and sustainability. Well, we cannot just, all of you know this, peace is not just an absence of conflicts. It has many dimensions. It has a social dimension, a political dimension. It has an environmental dimension, definitely. It has an international dimension. And what we see when we see a rise in conflicts and wars, we also see other very important issues go down on the agenda. I could talk about climate change, which has gone radically down the agenda because the world is more focused on war and conflicts. And we could talk about health at the same time. I'm actually now chairing a pan-European Commission on climate and health. And, we are being very focused because we need to reach the ears of the policymakers in Europe. And we know that there have been other issues on top of their agenda for the last few years. But climate and health are also a very important factor in ensuring the safety of the people. So when I think about what is peace, it's not just the absence of conflict. It's also a society where we see balance, where we see equality, where people can actually pursue their goals without being threatened. It's about human rights and justice. And I think, when we were talking about the Russian invasion in Ukraine, I recall Zelensky saying we need just peace, and I thought that was really important because we need justice when we talk about peace. We need to ensure that people can trust their institutions. We need respect and tolerance, and that is what we have been seeing in the last years. Respect for international law, respect for territorial sovereignty, respect for the rules that we should follow in war and conflict, like not attacking health workers and hospitals. We have seen that respect diminishing. So I think we're in a very precarious time when it comes to peace and war. I think we need to talk about the values that we base peace on, because without peace we will not have any progress. Without peace, we don't have any well-being. Without peace, we cannot really focus on building up and creating new things, because in war and conflict simply takes over. So I think, because we were supposed to be short, I think what is one of the most important goals right now to conclude that is to really integrate peace in government policy, not just to integrate how we defend ourselves for military interventions or attacks. And I understand that we need to talk about both, but we cannot just talk about the other, one and not the other. We need to have a much more active international collaboration, how we solve conflicts and how we maintain peace.
Thank you, Catherine. Thank you very much. Powerful statements about peace, and thanks for sharing experiences. Some references divide peace into two kinds of peace. One is negative peace, which we are talking now, which is about not having war in conflict, because there is no health, there is no sustainability without that. And another one, I think Catherine alluded to that, is positive peace, which is good governance. Positive peace is about institutionalization. So of course, to reach positive peace, we need to have somehow reach a negative peace, which is lack of war. And who better than Komaran, who can share with us? Komaran, you have been working in different capacities in different countries or bringing truly international experience. And now you're leading the Alliance for Health Policy and System Research in the Waters Organization, and you have been involved in the Sustainable Development Goals, and you are still very heavily. So I want to ask you to define for us how peace is fundamental for sustainable development and how conflicts can undermine health goals for that, and actually why global health is still insufficiently prioritizes the role of peace and health in addressing the conflicts. So based on your experience and expertise, please.
Good morning, everyone. Guten Morgen, and thank you, Amir, for bringing us together. And I think, Amir and Katrin, you've set the stage so well. This question of why is peace important for sustainable development? Last night, one of my friends and colleagues, we were discussing the sessions on peace and health and conflict in this summit at this time, and he said, slightly contrarianly, I think, why are there so many sessions? I mean, what is there to say? War is bad for health. We should stop it. So maybe I can stop talking now, right? But what people would say is that Thomas Hobbes said that the natural state of people is a state of war. And human civilization, human reason is an attempt to overcome that natural tendency. So again, I could stop talking now. But at the same time, and my response to him was, we are living in an unprecedented time of war, as you've reviewed. 61 conflicts last year, more than at any time since World War II. The projections for military spending this year globally are $3 trillion. And military spending over the last 2 years has increased more rapidly than any time in recent history. We have spent a lot of time over the last 3 days bemoaning the global health financing crisis. There's not enough money. How are we going to buy immunizations? How are we going to buy ARVs? That is true. It's a very challenging fiscal state for health in most countries. But sometimes we have to step back and say, well, there is the money, isn't there? Where is the money going? Right? So very quickly we see why the World Economic Forum, in its most recent risks report, global risk report, put conflict as number one. And conflict has not been number one for the last 30 years. My 9-year-old son asked me the other day, where would we go if World War III happened? And I reflected that the failure of our generation that we're having those conversations, because when I was a child, we had those conversations. You will remember in Iceland,
Yes,
Katrin, and
yes.
another country. And yet, for about 25 years, we didn't really worry about World War III. So, and yet, to get back to that situation is a failure of my generation. Right? So what do we do about that? So it's facile, of course, to say that peace is essential for economic development, it's essential for social development, it's essential for environmental protection, the components of sustainable development. That's anodyne. I think that the more interesting question, given that health depends on sustainable development, but health also contributes to sustainable development. That's what we said when we developed the Sustainable Development Goals 10 years ago, although that is often under attack now. What is the role of the health sector in enabling peace and enabling sustainable development? I think that's the question for us to ask. And for all the myriad efforts, the strong efforts that we see for the health sector to contribute, I don't think we're doing enough. Right? And I would like to highlight a few dimensions before I stop talking. Firstly, this idea that there is a humanitarian space over here, but that the normal functioning of the health sector is over here in peacetime. That is a fiction we cannot sustain. 2 billion people live in countries affected by conflict. A quarter of the world's children live in 26 fragile states, but they account for half of the children who aren't immunized. And I could go on, and you also have more information. So when conflict is almost like this natural condition. Health systems need to think about engaging and addressing conflict as part of their routine core business. We talk a lot about resilience, but we don't action it. So then we need to think about, well, how do you deliver health services in times of conflict? How do you deal with conflicted jurisdiction, where sometimes the state is not in control of the whole country? We see that in so many countries with conflict. What does that mean? Who is the health system, right? We often, is it just the national health system or the global actors for in the humanitarian space? Health services in conflict states are delivered by communities. They're delivered by local NGOs. How are we supporting them as the global system? And then I think we need to take seriously not just the acute impacts of health, which we talk about, the bombings, the amputations, the starvation. Yes, so important, we must. But the long-term impacts of health, the impacts on our routine conditions, on chronic disease, on mental health, the trauma, substance abuse, domestic violence. You said that being from an island has enabled you perhaps not to be beset by conflict. But to conclude, I come from 2 islands. I'm a Sri Lankan and I'm a New Zealander. It has not been a buffer, at least in one of those islands, for conflict in very recent times, a 30-year civil war. But even in New Zealand, that everyone would think about as a very peaceful country, the sequelae of the wars of colonialism in the 19th century still have huge impacts on health. So I think we need the health sector to be not passive about peace and health or conflict and health, but active, understanding the complexity, the multiple dimensions, and thinking how can it address conflict, minimize its impacts on health, but then think about its contribution to broader development to enable peace.
Thank you, Kamaran. Yeah, thank you. Elsar, I want to come to you. You come from a background which is experiencing now, your home country, Sudan, is experiencing very massive violence now, which is very heartbreaking. And you are very much engaged in your organization in humanitarian actions to stop war and set the scenes and somehow help people in those conflicts. I want to ask you that, in your view, why, I mean, because you have lived that, okay? You have first-hand experiences. Why health should be at the heart of the conflict? And if it is not, what consequences can happen? Could you share us with your experiences?
Yes, of course. Good morning, everybody. Yes, so first I just want to talk about, in general, at the macro level and the agreements that we have regarding my colleagues, and you have mentioned the Geneva Conventions and how we should not be attacking healthcare workers or infrastructure. And there's also the political declaration on strengthening the protection of civilians from humanitarian consequences in areas of explosive weapons, when explosive weapons are used in populated areas. So we, again, just to stress what everybody has said and what you have said also, is that we have the legal frameworks to protect civilians. However, we are not doing that. And I think we need to concentrate on this, and we need to find new means and mechanisms by which these agreements can be enforced. Now, coming to Sudan, Sudan has been at war since even before independence, so since before 1956, and the war has been going up until now. It has taken various forms, and it has transformed into other, how should I say, means of fighting. Why health should be at the center of conflicts? Because, first of all, it's a moral obligation. We need to service people when they are ill or when they are injured or where they are attacked. We must not take our eyes off this. It's a moral obligation. We need to do it. And also, again, it is enshrined in, it's a basic human right. It's also a stabilizing force, as my colleagues have said, because we've seen that when we don't have access to resources, and I think this is something that's at the base of every conflict that we experience, it's access to resources, and health is one of those resources. So if people are not feel marginalized, then this is seed for conflict. So we need to think about a more equitable way of making people have access to all of these services, health, education, training, capacity building in general, because if we have more equity, then I think the propensity of war would decrease. And again, no, there are many other examples, as in fragile states where already our health system in Sudan was already suffering, and with the war things have been exacerbated. But it is not all a bleak picture, because I know of personally 2 organizations, and one of them was actually nominated for the Nobel Peace Prize this year, which was the Emergency Response Rooms. And this is a purely community-based initiative, and it's young people. It's the youth, and this is another source that we really need to think about. And Africa has the youngest population in the world. So how are we going to invest in that? Because it's not only for Africa, but this is a resource for the whole world, knowing that in other parts of the world there are growing populations and elderly populations. So this is something we need to think about in our next policies and in how we can support this. So coming back to the emergency response rooms, this is a youth-based organization. They have managed to come together and provide services such as food, which people were not able. They had like soup kitchens, and they did it all by themselves, through WhatsApp and through communications and text messages. They managed to organize, and they managed to service many people in Khartoum and in Omdurman, which were two of the most affected areas. I'm also on the advisory board of the Sudanese American Medical Association, and before this latest conflict, they were mainly involved with training, and they were finding residencies for young Sudanese doctors to go to the United States to get their specializations. And after the conflict, they immediately changed their modus operandi, and instead of taking medical students out, they started bringing medical doctors into the country to give training in critical care in emergency responses to Sudanese and local organizations. Am I doing well with time still? Okay. And so I found this a very interesting way that we have managed to adapt to what is going on. It's also, they've provided materials for mobile clinics so that to make access to reach people who were affected. They've actually managed to reach Tawila, which it's in Western Darfur, and it was affected by a big outbreak of cholera, by allying with local organizations who already know what is happening in the communities, and they already know the channels of communication and distribution. And so this is the way that we need to think, and this is the way that we need to bring health into the center of conflicts, because if we do not build on the local knowledge, if we do not tap into that, if we do not tap into the young generations, I think things will not be going well.
Thank you. So what you mentioned is very crucial, because there are some evidence, specifically in those conflict zones, if we engage with the community and people contribute to building the healthcare resources, there is a less probability that they are attacked. So this is another thing that we need to consider and bringing to the community, engaging with the community. Thank you very much, Sarah, for sharing your experience with us. Petra, you are representing one of the biggest organizations in human activism or humanitarian actions, IFRC, and you are quite on the front line. And I ask you that I can share your experiences as well. I mean, Petra is Lebanese, and she has experienced the vast blast in Beirut back in 2020. Actually, she was injured, and she led the national response to that. So she's not only representing the IFRC, she is the survivor of conflict. and she has led the national COVID response and lots of these experiences. I want to ask you about the international frameworks which we've discussed, and whether, I mean, there are many international frameworks, but are they sufficient? What are the challenges? What are the hopes if you want to somehow reach sustainability, whether those frameworks are efficient or we need to do something else? Please share with us your experiences.
Thank you. Good morning, colleagues. Let me start by, yesterday we all slept on the news of a peace summit. One thing that came to my mind is all of those member states sitting in that summit have committed to international frameworks. It would have been good to remind them all about their commitments. If we go back in history, the international humanitarian law started 1864, and it started at the premise that everyone should have healthcare, including the soldiers in a battlefield. That was the reason why the Geneva Convention adopted IHL, because Henri Dunant, who was a Swiss philanthropist, witnessed a battle, Solferino battle it's called, where 20,000 soldiers were left to bleed and die. And in his view, everybody should have health, even in conflicts. And that's where he started the mission of the Red Cross. He went to neighboring villages. He got the women to walk to that battlefield. He flipped the Swiss flag, and that's where the Red Cross came. And he said, health is a human right, and everybody, even if you're a soldier, you have to get healthcare in conflict. And then from 1864 till 1949, after the World War, they started adding more protocols. 1977, they added another protocol, and then 2005, another protocol. So that's one framework that everybody talks about. And now we will come to what's left of this framework. What is left from the IHL? The second one is, I think you mentioned the UN Resolution 2286, which speaks about preventing and addressing attacks on healthcare and conflict. It is a UN Security Council resolution. So all Security Council members have adopted this in 2016, where they said that we need to address and prevent attacks on healthcare in conflicts. And then the list goes on. We can talk about many other initiatives, but those are the main landmarks that govern healthcare and conflict. The outcome, as we've seen in the last 4 years, is simple. There's no political will to endorse these frameworks. We have, in the last 4 years, created a world of impunity. And there's acceptance now to demonize healthcare facilities as battlefields. There is acceptance to attack ambulances. It is okay to say that if you're wearing your Red Cross emblem and you get attacked, it's fine, you're collateral damage. For the Red Cross, the last 2 years have witnessed the deadliest 2 years on our volunteers and our staff. What does it mean to humanity? I think for the Red Cross, it is deadly, but for humanity, it's worse. Despite all of the wars since 1864, so we're talking more than 160 years, despite that, we still respected the people that worked in humanity, and we managed to give them their own space to work and serve. Who's going to pay the price of all of that happened in 2 years? The individuals, the institutions, and the systems, which is all of us here. This is our space. You mentioned personal experiences. Health is the first victim in any conflict, in any disaster. I always say any disaster that happens is going to end up being a health disaster. If it is drought, we're gonna have disease outbreaks. If it's health is always the first victim in any disaster or any conflict. The challenges today, other than there is no political will, there's also no endorsement to implementing this. But even if we dismiss the endorsement part, we still see a blockage of supply chain. So the normal thing that, okay, you don't want to protect healthcare workers, you don't want to protect health facilities, but let them work. So forget about the protection. Even on the supply chain, There's disruption on supply chain. There's blockage of aid coming in. There's not enough funding for the health services in conflict. We want to provide healthcare, but it doesn't come for free. It does require financing so people receive health. And I think there is now more and more hope, in my opinion, coming to the point of hope. And where do I see hope? Last year, if all of you remember, despite Gaza and the conflict between Israel and Gaza, we managed to vaccinate more than 700,000 kids in Gaza for polio, 2 rounds. There's hope because communities are very resilient. People want to live. When I connect with the Palestinian Red Crescent clinics in Gaza and I see these women bringing their kids to get those polio drops, what does it say?
Hope.
They want to live. They fear that their kids die of polio when possibly 30 minutes as they walk out of the clinic, they're gonna die of injury. But they still want to live. That's to me, this was very hopeful. When I see the volunteer of the Palestinian Red Crescent going out and responding, that's a volunteer. This is not someone getting paid to do that service. It is hope. The second thing that I'm really hopeful about, public pressure has worked. Public pressure has got us to the point of yesterday, whether we like it or not. People have spoken, people have said, enough is enough. We do not want to still go with the political empathy towards those behaviors. We don't agree with it. And the last one is, which I hope does more, the medical associations and the healthcare professional associations, they still have to do more to stand up for the healthcare system in conflicts. They have the ethical and moral duty to do more to protect their colleagues in the battlefield. Thank you.
Thank you very much, Petra. What you mentioned about vaccination in Gaza is a very strong example of hope and trust as well. I mean, they may get killed, but still they trust the health system and they get their children to have the vaccinated. That's fascinating, and the public pressure as well. Thank you very much for those very important remarks. Parian, you work in an organization which is at the front line of any conflict. So MSF sends its staff, medical doctors, healthcare professionals to the war and conflict zones. And we mentioned there are some, unfortunately, occasions that staff gets killed because of this war. And I want you to reflect upon how we can actually have a better resilient system to protect healthcare staff on the front line, and how war can somehow prevent those staff to be killed who are the engine of providing healthcare services, and share your experience with us. Thank you.
Good morning, and thank you, Amir, and the World Health Summit, as well as the Tehran University, for bringing us together, for having this conversation, which is important. And I agree, after my colleagues elaborated, that there can be no health without peace, and no sustainable peace without health. But as MSF, we must also ask a harder question. You, Amir, said at the beginning, how can we prioritize health? And I would like to ask, how can health and the right to healthcare survive war? At MSF, we approach, as you mentioned, this discussion from front lines, and across the places we work, we do see the same pattern. Hospitals bombed, patients killed, doctors killed, humanitarian workers criminalized. For my colleagues in over 70 countries in the world, the intersection of health and peace, or unfortunately war, is not just theory, it's their lived reality. And I mean, Petra just elaborated how IHL was built from Dunant to IHL, and it was built to protect civilians. It was built to draw a line even in war. But this line is being erased over the past years. 2015, our hospital in Kunduz was attacked by the US Army. 42 people were killed, patients and colleagues. It was followed by the resolution 2286 in 2016. But from Kunduz to Tigray, from Yemen to Sudan, and now in Gaza, we see that the rules to protect the civilians and the wounded are ignored. Petra had mentioned humanity is at stake. Yes, and we are at a critical moment. Critical because attacks on hospitals, health workers, and patients are multiplying without consequences. Critical because belligerents are not just failing to protect healthcare, but they are deliberately targeting hospitals and healthcare workers. Critical because humanitarian and medical workers are being left alone to uphold the laws and principles that states are abandoning. And critical because counterterrorism and funding restrictions and political narratives are criminalizing humanitarian action. The rules that were once defined are stretched and ignored. What we see in MSF is in South Sudan, hospitals were looted and bombed, and regions were cut from healthcare. We talked about Sudan, the place with the highest displacement. We have the displacement crisis, we see malnutrition. And in Sudan, hospitals are attacked, my colleagues are attacked. We had to leave patients behind. In Haiti, patients were attacked, ambulances were attacked. Patients were taken out of the ambulance and killed. In Gaza, in the last 2 years, we lost 15 of our colleagues. 15 of our colleagues who were killed while they were caring for patients, while they're serving patients in the hospital. Just 2 weeks ago, 5 of my colleagues were waiting for a bus to be taken, MSF bus to be taken to work. They were attacked. 3 of them were injured. 2 of them were killed. These are not tragic side effects of war. They are often deliberate choices. They show how health itself is being weaponized. So, coming back to your question, Amir, is what do frontliners need to be resilient? And frontliners, we have heard it, are most of the time local colleagues. These are the people who had suffered the conflicts, the war, losing family, losing their homes. What they need to be resilient, to still continue despite all these challenges, to care for wounded, to care for those in need, is to know that they will not be a target, that they are not a target when they are working in a hospital and caring for patients. That means enforcing international humanitarian law, not just reaffirming the statements. It means ensuring accountability when hospitals and healthcare workers are killed and bombed. And as a medical profession, it means safeguarding medical ethics, safeguarding independence. It means not instrumentalizing aid. So, as we speak of peace through health, we need to remember that preservation of medical space and protection of patients and those who care for them needs to stay at the center. and we need to have the courage to act while humanity is under attack. Humanitarian aid and access to healthcare must not be criminalized and must not be targeted.
Thank you. Thank you very much, my co-panelists. We heard from this experience and distinguished colleagues that we do have lots of laws, international laws, and the enforcement of those international laws is an issue. The ethical code is something which is crucial, and we heard that there are hopes as well. I mean, that's why in the World Health Summit, we need to discuss, and any other global platforms, we need to discuss how we can actually ensure that the healthcare personnel, healthcare facilities, patients, citizens, civilians are not injured. And Petra mentioned, it's very painful, but that's true, that health, unfortunately, is the victim of war, and unfortunately health is becoming sometimes the prioritized victim of these wars, which should be another way around. And we need to do something to make sure that happens. We have few minutes for your interventions. If you have any question, please raise your hand. My colleagues will bring a microphone. Please be very, very concise, because we have only 5-6 minutes for that, and we need to go to the second round of our interventions. Just introduce yourself, who you are, and your question. Address the question to a specific person. If not, I address that, and then we go. This lady in the middle, in black suits. Yes. Yes, please.
Yeah, thank you so much to all of you for these very, very impressive presentations. I'm Heidi Richter-Airioki from State Parliament of Saxony-Anhalt, which is a state in Germany. My question goes to Dr. Rasanathan. Since you are here from WHO, we heard an introduction also at the beginning of this summit about the latest report on the global burden of disease. Now, this concept of global burden of disease has also been recommended at sometimes to be used by policymakers also when it comes to interventions in relation to conflict and war, to make projective assessments on a burden of disease for certain interventions and also evaluative assessments. Because it's a summary indicator which shows, is being used, which shows both mortality and also disease impact of different factors. And one could do that for interventions and in war and conflict. Could you imagine that WHO could also support such assessments for global burden of disease to support governments in their assessment to make...
sorry, ma'am. Sorry to interrupt you, but do you have any specific question for war and conflict as well? And please just stick to one question, because there are so many.
But that is my question. For war and conflict, to use the burden of disease approach to advise governments how certain interventions will affect the burden of disease, meaning mortality, morbidity.
Thank you.
Would WHO take such a role?
Can we take other questions and then we come to you for answers, if you don't mind?
Do you want me to answer now?
No, I come to that. Thank you very much, ma'am. That lady in black suit again at the end of this, and then I come to this gentleman after. Is from this side, who is... okay, there are too many questions. I may have asked you to stick to that question for the second round. We have another round for the question, please.
Yeah, Dersim Dadevren from Germany-based network of Kurdish academics. I have just two short remarks, which are also a question to the WHO. What about the prisons in conflict zones? For example, we have these pit-type prisons in Turkey. Also isolation of prisoners. There is İmralı Prison Island in Turkey, where the European Court for Human Rights ordered that the right of hope to be implemented. It's not implemented, and the health sector is silent about such issues. And we have also, as the Tehran University is hosting this panel, we have the issue of executions. And what about the interventions of health organizations on these issues, because they are also part of conflict and health.
Thank you very much. Yes, there's a gentleman in the back who was, I want to have a gender balance in the questions as well. So this gentleman in the front, sorry, I want to have a kind of gender balance for questions as well, please.
Thank you. Thank you very much. My name is Omar Najib. I am from Sudan, like Sarah. I was actually the Federal Minister of Health until the military coup in 2021 that destroyed the transition and eventually destroyed the country. I am also an occupational physician, and my real concern is if we're talking about sustainable health development, we got to look after the healthcare workers who develop that. We've seen how many of them have been killed. I'm just going to ask probably one question to my colleague in the WHO.
So all questions is for WHO. Like
I'm really sorry. There are so many doctors and nurses and healthcare workers have been killed during this conflict, which is absolutely unprecedented. This actually started well before, the Gaza war. They actually started this, and everyone kept silent about it. Everyone kept silent about it. And I think that is what got it. My question is, as we speak today, there are 14,000 young doctors who have lost their training, their internship in the Sudan. They are scattered all over the country. 3 of them were actually supposed to come to here. They were stuck trying to get a visa to come to this conference, but obviously not. What can the WHO do to support this? Another small question to Sarah, if you would allow me. Sarah, the emergency response rooms, they've been doing and still doing a great job. One of the most important things they've done, they have been protecting the healthcare workers, because the two warring parties were actually targeting the healthcare workers, kidnapping them to use them, not to use them for treatment. How can we support the emergency response rooms now? What programs can we put in place?
Thank you very much. Unfortunately, we don't have enough time. I'll come to the second round of the question in a few minutes' time. Just bear with me. Come on, it looks like we need to have another session in next WHS for WHO to respond to all of this. But if you can be very quick, then ask Sarah, and then we go to the second round.
I'm pleased to see that WHO is still in the center of global health in terms of the questions. And I mean, I lead the Alliance for Health Policy and Systems Research, and we very much look at the role of research in conflict and health. That's what I'm here for. But obviously, WHO has a huge role, and colleagues in the WHO Health Emergencies Department very much are leading on this. And from the boss, Dr. Tedros, is very clear on these issues, from that there is no health without peace and no peace without health, and has been very strong and brave, dare I say it, in terms of WHO's role around conflict and health. So if I can try briefly to answer the questions, because I feel many of our other colleagues would be able to answer many of these on the panel. Firstly, on the global burden of disease, WHO was very much involved in the development of that methodology. Of course, our colleagues at the Institute of Health Metrics and Evaluation are very much have taken a lead on that. The challenge of that, to your question, can that be used in terms of thinking about conflict and health? I mean, that is a rational input into decision-making. And war is not a rational process, right? At the same time, and one of the things I'll talk about more, is that we don't learn enough about the conditions of health in war. We don't have enough data. I will talk more about how we don't have enough research. So if your question is, do we need more information and learning to understand how to prioritize, which interventions work, what we need to do? Absolutely. And that is very much what my colleagues in the WHO Health Emergencies Program work on. But the challenge, of course, is that we have the worst data in conflict situations. And so for what we need to do, the types of complex modeling to create global burden of disease estimates, it's possible, but they're weaker and less valid in these situations. But again, I would say, in these contexts, it's not really a place where you're doing rational decision-making or rational policy-making. It's difficult. All the more reasons that we should strive for it. And certainly mortality estimates are very important, and that's certainly something that WHO plays a strong role in, from surveys, from modelling. But the specific methodology of the global burden of disease can be challenging in conflict settings.
Thank you. Other colleagues, do you have any reflections on those questions?
Maybe on the prisoners, because the question related to prisoners. So the mandate to visit prisoners is given to the ICRC. And this came under IHL in 1949, as I mentioned, the additional protocol added. And the process to visit prisoners is confidential. It is not announced and it is not publicized. That's part of the process. However, disregard to IHL is normal these days. So I'm not surprised that there would be prisons in the world where ICRC would not be allowed to visit. But on the mandate, just to be clear, because that's not a WHO mandate, the mandate for prisoners of war is for the ICRC, and that's the role they play. They do millions of prison visitations in 90 countries a year.
Thank you very much. The question for Elsara, because she will have a first intervention, I ask her to kindly, because for the sake of time, to combine her answers to your questions in that one. So let us go to the second round of interventions. And in here, we want, in the first round, I come to the question in the second round, if you allow me. In the first round, we listened to our panelists regarding how peace is important and what are the challenges. In the second round, we want to go to more policy-oriented discussions and see how we can craft good policies and how we can address those gaps. There are lots of international laws, different versions and things, and how the global health community can contribute to this. Let's start with Elsara, and then we can answer that question in your interventions as well. How we can actually craft tailored strategies to protect healthcare infrastructure in crisis, because we do have laws, we do have lots of frameworks, but in 2025, after all these things that we're living in, is there anything that you think that we need to do specifically to craft a better law or framework to protect health and bring health at the heart of conflict?
So I don't have, for me, I would just try to implement this, but I think this is a more complex question, and many of my colleagues on the panel and in discussions outside, even with other colleagues, this issue of how do we implement this, I think we need to put our heads together. We need to think out of the box. We need to think about how organizations such as the UN and the Security Council are structured at the moment, and how can we think about developing new ways that will allow us to have a more equitable decision-making. And we really need to think about this right now, because we see people are dying, health infrastructure is being attacked, health workers are being targeted and killed, and this has great ramifications, not only for today, but for afterwards. When we do achieve peace, how are we going to rebuild our health system? How are we going to recover all of the waste and all of the loss of investment in cadre, in human resources? So we need to think about more out of the box and things that we have been adopting and believing in for the last 70 years. Now is a time, I think, when we need to rethink all of these policies and all of these laws and the means of implementing them that we've had until now. And I think this is a very provocative, maybe, statement, but we do need to put our heads together and think about this. Another thing that I've already alluded to before is our youth. We've seen how youth have been shaping the political scene in Nepal, in Madagascar, in Bangladesh. Gen Z. It's not just they're just not about expressions that they use online, but they really are very politically savvy, and they use technology that sometimes is used negatively, but they use it positively. So we need to think about how to invest in the youth and how we need to bring them into the decision-making process, because they are the leaders of tomorrow. So this is something that we need to really invest in. Of course, we need to think also about technology and innovation, and how are we going to bring this for the service of health and the health sector. Drones are used to attack people, but how can we use drones to deliver health? How can we use drones to surveil areas that need assistance? And this means that we also need to think about policies that allow us to fly drones in areas, and how are we going to protect these drones that are used for humanitarian aspects. We need to think about developing new medical equipment that is easy to transport, you know, like I was listening to a podcast the other day on the BBC, and it's called People Helping the World. And so they were talking about a backpack that you carry for surgical theaters. So we need to invest more in these things, and we need to develop policies and work at the international level and with international organizations such as the WHO and others on how to invest in these these new innovations. And of course, coming back again and also mentioning the fragile states that already, with fragile health systems, that even in normal conditions are not able to service their civilians and their people. How are we going to invest in that? Sudan is, we have amazing doctors who have had amazing education. You know, University of Khartoum was one of the universe centers of education for other African countries. Ahfad University for Women, they had a very innovative medical school where the target was women doctors, because we know that this is something that sometimes women are not, they have an impediment to approach doctors because of all the social and cultural values that we have. And Ahfad University for Women was training women doctors at very high levels. So how are we going to rebuild all of that, and when we start from fragile health systems? So we need to think about how do we help these fragile health systems before we go into conflict? Again, stressing the idea of health for peace, because if we do invest in health, if we do invest in health systems, this can be a motivator for peace. We have to close the circle. We have to think about fragile states, preventing these fragile states from going into war, because it is a war for resources many times. And then if we are at war, how are we going to make policies that guarantee access to health? And eventually, how are we going to invest in our young people for the future of tomorrow?
Thank you very much. Prioritizing the youth and investing in the Gen Z is very, very important. Thanks, Sarah, for those points. Petra, let's go to you. You mentioned about the frameworks, and we have. And the World Health Organization has a Global Health Peace Initiative. And in that, one thing which is mentioned, I quote, is health first, peace agenda. I like this. And this is somehow the main message that we're going. I just want to ask you that how you think that we can mobilize stakeholders around that idea, given the experience of IFRC that you mentioned, to have a kind of more unity and alignment between different stakeholders for that agenda?
Sure. A few things. First of all, people come to the healthcare facility seeking two things: healing and hope. Peace is about healing and hope. So health and peace are two faces to one coin. They're both propagating healing and hope. For us, when we work in conflicts, our stakeholders are different. I'll just give you examples where you'll see how we put health first to propagate peace. If we go to DRC is a country that suffers from multiple conflicts, in addition to multiple disease outbreaks. They're currently combating their 16 Ebola outbreak. The DRC Red Cross has managed through all of those 16 outbreaks with the conflicts to connect with all of the communities and maintain health in these communities, despite the tensions between them. So bringing health as an element to lower tensions between communities. Another example, which is very relevant to our days, last November 2024, David Maged Adom, which is the Red Star National Society of Israel, signed a memorandum of understanding with the Palestinian Red Crescent to support each other on the humanitarian crisis. We are now celebrating a peace summit a year after, but on the ground, humanitarians have managed to talk to each other in the most politicized conflict, in the most tenuous conflicts. They signed an agreement, not just by talking, but in an event in Geneva. They both came and they signed the agreement. So we manage. Humanitarians, if politics move aside, humanitarians can work together to bring health to communities. Another example I'll give, Syria before the latest changes. As you all know, there had been northern Syria and the rest of Syria. We continue to provide services on the totality of the Syrian land, despite the separations and the disputes there. You mentioned Yemen. The Yemen Red Crescent continues to provide safe haven health space for people from different political backgrounds to come in and receive care irrespective of who they are or who they belong to. So that's within the stakeholders, how we use health first to propagate peace and lower tensions. With the government stakeholders, frequently, we do what we call an initiative called health care. So it's not healthcare, one word. It's health care in danger, which means that the care of health is in danger. So we convene with ICRC multiple workshops and closed-door meetings, confidential meetings, to talk about the issues that were raised today and how we can use actually health to support peace and propagate social cohesion. The last one is with academia. There's a lot going on with academia when it comes to building protocols, building research to support and advance this agenda. So going back to your point about health first and peace, I'd like to link it back that both propagate healing and hope, and you cannot have a peaceful agenda without a healthy agenda. Thank you.
Thank you very much. Panyan, let's come to you. And you mentioned the role of the MSF. And again, something for the frontline staff is togetherness and working from across the sectors in order to protect themselves and in order to somehow synergize the way that they are serving the people. Could you share us what is still needed to strengthen this capacity of the work professionals, healthcare professionals in the front line in a humanitarian organization like yours and others?
Yes, and maybe first of all, I do understand the intent to strengthen peace and strengthen health in fragile settings, but I would like to caution to overloading healthcare workers with the development of peace. Peace and health are interconnected, yes, but they are both rights in themselves. Mm-hmm. As a medical doctor, if I treat my patient, they need to know that I treat them regardless of where they come from, what they do believe in, what their political background is. Health cannot be conditioned, and healthcare should not be instrumentalized. So what they need is to know that they are not part of a party. Healthcare workers are not part of a party which develops peace or goes into war, but it's impartial and it's there to treat the patients. That's, for me, the basic of medical ethics, but it's also the basic of medical humanitarian care. And this we need to ensure at the first place. So we need to have this trust from the communities. We need to have this trust in the section. We need to work with humanitarians, with healthcare workers at the front, with ministries of health. But we need also to be able to talk to all parties in a conflict. And there again, we need to ensure that humanitarian principles are taken also seriously by those who had put IHL at the first place. So what we need is from governance to recommit to IHL again. We need to have independent investigations when hospitals are attacked. We need to have we need to be sure that humanitarian aid is not criminalized and not weaponized. I mean, what we have seen with the Gaza Humanitarian Foundation is instrumentalization and militarization of aid. This is what brings aid workers in risk, and not just aid workers. We have seen people trying to get food being killed, orchestrated killing, while they were just trying to get food to save themselves and their families. So it is, once again, it's about ensuring that international humanitarian law is adhered to, and acknowledging that the principles of medical ethics and medical care are upheld by themselves, and that they are not conditioned to reach another goal.
Thank you very much. Adhering to the international law and protecting them and making sure the medical ethics is at the core. Thank you very much. I'm a bit curious of time, and I want to have your engagement as well. Komanan, you direct the Alliance for Health Policy and System Research, and in the last quarter of century, the Alliance has been quite fundamental in capacity building and endorsing research, specifically in low and middle-income countries. Of course, we need robust evidence, and to protect the health of civilians and health peace agenda, we need to have robust and good, reliable evidence how we can protect health and how we can deliver healthcare services in a way that the healthcare service professionals are not attacked and the hospitals are not attacked, these kind of things. And then that evidence is very important. And I want you to reflect upon how we can actually produce that evidence and a specific role of the Alliance in doing so.
Well, I think some people would say when hospitals are being bombed, when health workers are being attacked, when people seeking health care are being killed, research can seem a bit like a luxury. Why would you invest your resources in doing research? And to that I would say, and I think Petra has already mentioned it, that in the most challenging situations, the premium is on us to learn the most, right? If we're not learning, how can we prioritize people in these situations? How can we serve them better? I'm pleased to hear Petra say, absolutely, there's more interest, there is more research happening, there's more learning happening. But in general, this is a space, because of the challenges, certainly for health systems research, we see the least research. And a lot of that research is conducted in institutions, often in Europe or North America, where the conflicts are not taking place. And so that's something that really we need to change. The American University of Beirut is an exception. It's a very strong institution, There are other institutions. But if you look at the sort of conflict and health literature, where it's generated excellent colleagues, but it's skewed. Right? And so then the question is, this is not about writing papers and the Lancet, however wonderful that is and useful that can be. This is about actionable learning that informs what we're doing. This is about research on the how. If we don't like the word research, you can call it learning. Is what we're doing effective? Are we reaching the people we want to reach? Could we deploy our resources better? Even in these difficult situations where international humanitarian law is being violated, are we protecting health workers and people as best as we can? Are we prioritizing the right conditions? I mean, one of the learnings from the work of the Global Burden of Disease is how do we support non-communicable disease care in humanitarian situations, in conflicts. And our colleagues at WHO are doing a lot of work on that. That's often very neglected, mental health. So there is this real, learning is important. And if you don't take my word for this, I remember talking to Joanne Liu, who used to lead MSF, and she reflected when she first went to Ukraine with 2 colleagues. They had 90 years of experience between this team of 3. And she said she didn't think they'd really written any of that down systematically. Right? So we need to learn. We owe it to these communities to learn. In terms of the role of the Alliance, we work with the WHO Health Emergencies Programme and to look at, well, what are some of the ways, some of the key issues that we can learn from. And currently we're doing work in Ukraine, Somalia, and Yemen. In Ukraine, we're looking at a very interesting situation that in most of the country you have a mature health system, the sort of orthodox health system that is dealing with both the acute and the chronic consequence of the conflict. And considering how does that happen? In Yemen, for example, it's looking about when you have divided jurisdiction, what does that mean in terms of the governance? Sometimes in those settings, people still prioritize health. There are channels, ways that commodities can flow. In today's world, that sadly is increasingly rare. So we're doing that on the one hand to strengthen the evidence base, but also to strengthen institutions in those countries to do that work, to ensure they're protected as well, because this work is fraught. To be a health researcher doing this work can be very fraught. So I really do think we have this obligation to learn more so that we can do better. Finally, I would just like to answer that question about the health workforce. That's another site of learning that is so important and is so disrupted. Some of the long-term effects of conflicts are about the disruption of the health workforce. Health workers killed, health workers' education disrupted, or health workers migrating. And I think that certainly WHO has a role. The WHO has a WHO Academy, which is a more dynamic way of providing support to learning. From my own personal experience, in Sri Lanka during the Civil War, there was so much disruption to training. But in Jaffna, in the north of the country, the medical school only closed for small periods of time, but it kept going. 2 of my cousins took 11 years to finish medical school because it stopped and it started, but it kept going. And the country, both sides in the conflict, still had some commitment to training. How can we need to support warring actors to still consider how to support training of health workers. And then finally, Sri Lanka has a huge diaspora. I'm part of it. The diaspora has continued to contribute and still does. Now the question is, are the conditions there? Is it safe for the diaspora to contribute? And that's the sort of thing we need to support because there are going to be disruptions to the health workforce.
Thank you. And that kind of learning and documenting those experiences and providing practical evidence is crucial even during the war. Thanks, Commandant, for sharing your wisdom with us. And finally, Catherine, I wanted to ask you as the final person in this round, because as a politician, what we have heard, I want you to have your reflection as a high-level politician. We have laws, we have international frameworks, and of course, implementation is not that much satisfactory. And still, I think there is a need for integrating health into the security agenda at the global level to ensure that health is being prioritized by the policymakers, by the politicians, and in practice as well. What are your reflections about the actions that we need to do to make it happen?
Well, thank you. 3 thoughts from me. First, I think the problem is that we're dealing with a world where cynicism has become a driving force, and cynicism is not a good driver for positive progress. And I connect that to the fact that we're living in a very polarized world right now, that the new technologies are exaggerating that polarization, and we are seeing more and more people saying, well, there have always been wars, how do you solve a conflict except with a war? And there is a lack of hope, and that's why I was so genuinely, I really felt very warm inside listening to Petra, describing to us hope in Gaza, because hope is what we need right now, because hope is a real driver of positive progress when it comes to maintaining peace and achieving peace. And cynicism won't get us there. And that leads me to my second thought, which is the fact that we've also been in, we have seen a shift of values, if you say so, considering health, well-being, education, soft values, but we have been moving over to more tough values, masculine values, muscle power. And speaking as an ardent feminist, I think this is something that we're not only seeing in wars and conflicts, we're also seeing it in all our discussions on health, on social justice, on gender equality, which has become a topic that you cannot even talk about any longer. So I ask myself, where are we when we are in the middle of this value shift? Of course, we need to react. We need to talk about the fact that these softer values are not soft at all. That health is nothing, there is nothing soft about health. And talking about well-being and health is really maybe the toughest value of it all. So these are my two thoughts on that. But you asked a very concrete question on how do we enforce international law? Well, the fact is that there is a growing cynicism towards the multilateral institutions that we have. And that's being fueled. That's being fueled in this polarized debate. I say we must defend those multilateral institutions. We must talk honestly and candidly about what we can do to enforce respect for international law, which has been diminishing, as I said earlier. And we need to also find good examples of how we have been doing this. And I can mention one good example from Iceland, so we'll conclude in Iceland, because we actually have a national security policy. And that was quite a complicated issue forming that, because there was a conflict. Should it be a military policy only, or should it talk about security and safety in a holistic way? And then some people said, that's too soft. You know, if we talk about health in national security policy, isn't that too soft? If we talk about the fact that economic inequality is a threat to the social cohesion, that's very soft. But that's not soft. Because if we see social cohesion disappearing, if we see inequalities in health, we have a problem. That's a very tough problem. So the conclusion was that our national security policy is not only about military and defense. It's about health, it's about economic threats, it's about ecological threats and environmental threats, and of course it's about natural hazards, because I come from Iceland and we have volcanic eruptions several a year, so we're used to dealing with that, but that's also a very real and tough threat. And I think we need to think about those values and the fact that those that favor the muscle power are right now on top of it, and we need to react very strongly if we want to really ignite that kindle of hope which is necessary if we want to reinforce and reinvigorate the multilateral system, which is, after all, the best one that we have.
Thanks, Catherine. So health for security and health and security are very crucial for sustainability. I wanted to give 1 minute to our panelists for takeaway messages. I asked them to keep it to 30 seconds if possible, so we have some questions from the audience. If you can share the microphone with this lady in the front, be very concise. All together we have 5 minutes and we need to cover many things.
Yes, thank you for very insightful discussion so far. I am Johanna Säkkinen, a medical student from Helsinki, Finland, and I'm here representing the International Federation of Medical Students Associations, which in turn represents 1.5 million medical students worldwide. As reflected several times throughout the session, health is essential in building and maintaining peace. My question is, what kind of roles could young generations of medical professionals assume in conflict resolution and mediating peace between stakeholders, while emphasizing the interconnection of peace and health and the respect for international humanitarian law?
Thank you very much. A very important question. We come to that in a minute. Other hands? That gentleman in the back, the last row, with glasses, yes. Be very, very concise. 4 minutes we have altogether.
Thank you very much. My name is Luis Bernal, School of Public Health, Hong Kong University. I am original from Colombia, South America. We have had a long-lasting conflict. And I used to be a Human Resources for Health Director at the Ministry of Health. And one of the things I faced at that time, agencies coming from Europe and North America trying to recruit Human Resources for Health, especially nurses. So what is the role or the responsibility of the international community to not to hire Human Resources for Health from countries who are in conflict?
Thank you very much. And this lady in the front, I'm afraid we don't have enough time. I'm so sorry. This lady in brown scarf. Yeah.
Thank you, and apologies for my voice, but I'm Nora. I'm a Norwegian medical student. I am 23 years old, and my generation, Generation Z, has been the first generation to witness genocide on social media. We have witnessed the downfall of democracy, and we have witnessed international humanitarian law being torn apart. I thank Dr. Sara for bringing youth into this discussion and highlighting that we are not only victims, but we are also important change makers. We are leaders and we lead community initiatives, and we are not only the future, but also essential parts of our communities now. So my question goes to the ICRC, MSF, and WHO. What are your efforts in including youth in change-making processes, and how are you working to support youth initiatives?
Thank you very much. So the youth is very important. I think that's a very crucial question, how we can engage medical students, young medical students in that. Who wants to go first? Petra?
Yeah, sure.
Very, very shortly.
Well, for us, the youth is our base. We have 17 million volunteers. I can guarantee to you that more than half of those are youth. So we are driven by the youth agenda. And I think when I mentioned hope at the beginning and I said public pressure to get us to where we are, that public pressure was driven by the youth. And I'm not one of those that you are the future. You're actually the present. You're not the future. You have put us all that are in positions now to our toes that we need to deliver. You are holding us accountable, and you're holding your legislators accountable. For IFRC, youth constitute a large portion of shaping our strategies and agenda, for sure.
Thank you.
And
Come on up.
very briefly, Dr. Tedros has led a lot of initiatives around greater youth participation in WHO. We have the Youth Council, which IFMSA is part of. We have much greater equalized opportunities for interns at the WHO. We had a young professionals program. One of our young professionals was from Gaza. So absolutely, if our generation has failed, we need to support your generation to address these challenges.
Thank you very much. I need to close in a few minutes' time, so I want to ask each of you for 10 to 15 seconds. Give us one takeaway message, which is the most important thing that you think that we need to do for the international community. Panion, starting from you.
Okay, 15 to 30 seconds. My message would be humanitarian aid cannot depend on political deals. It cannot wait for so-called peace plans, ceasefire arrangements. Women don't stop delivering babies. Chronic diseases don't disappear, and war wounds don't stop bleeding just because, the discussions are pending and peace agreements had not reached yet. What we have seen in Gaza over the last 2 years, as it was mentioned, was a genocide. We're seeing hospitals being bombed, healthcare workers killed, And if we ignore that, if we let this happen, then healthcare, medical workers are at risk all over the world.
Thank you, Vanya. Petra, take away message.
I think my message is a political crisis cannot have a humanitarian solution. And in the last 4 years, the political architecture has laid over the humanitarians to solve it. And Afghanistan is a real-life example. It's a political crisis that is now ending up shouldered by the humanitarians, and we cannot solve it. So my message to everybody, you're all constituents of a political system. Please select wisely how we want this world to be governed in the future.
Thank you. Come on.
We live in a world of conflict which has a crisis of solidarity. But we should not lose hope from that. The multilateral system, for all its flaws, was a response to the horrors of the world wars. International law is a response to those horrors, the Declaration of Human Rights. They remain relevant. So we should not lose hope in multilateralism. All of us have to contribute to a better system. And we feel that research and learning plays an active part. But moreover, we should not, in the health sector, think that dealing with wars, dealing with the impacts of conflict are just for MSF and IFRC, for all the amazing job, or WHO. This is all of our business, and it's for us to contribute to the health sector's role, but also to that greater political project to re-establish solidarity.
Thank you, Sona. Catherine?
The multilateral system, yes, it's in a crisis, but coming from a small state, knowing that this system is the best we've got, to respect international law, to respect humanitarian law, we need to put pressure on our leaders to nourish this multilateral system and to find ways not only to achieve peace, but to sustain and maintain peace. And we are, as a globe, as a world, we are not putting enough efforts into that. Because maintaining peace is about maintaining social justice, ecological balance, human rights, and this is what we should be focusing more on and spending more money on, because they are also the driver, can be the driver for a positive change. But this needs to come from also the public pressure, because we are faced with a crisis.
Thank you, Catherine. And last but not least, Sarah.
So I agree with what all my co-panelists have said, but I just want to, since it was more directed at policymakers, I think I'm going to address people here in the room, and I want you to think of one thing that you can contribute to bringing sustainable peace through health. And if you want to discuss further, we can talk about it, and you can reach out to me directly or to the organizers, and I'm sure they will relay this message, because we do need to bring our heads together and think of more innovative ways and out of the box to what we have been doing. Thank you.
Thank you very much. Could you accompany me with a round of applause for our beautiful, wonderful panelists? And the second round of applause for your good self, for sharing their experiences and being so tolerant to spend your morning with us. Health and peace are very interconnected. In the world that multilateralism is diminished, democracy is fading, and big togetherness is under attack, and war and the number of conflicts are unfortunately rising, we need to have health as the sticker of bringing communities together and as the fundamental for peace, and peace as the foundation for health. So this is a dream still, but there are some hopes, as we mentioned. Hopefully, in years to come, we continue discussion and we have a practical framework and a practical way of addressing health and putting health at the center of any conflict. Unfortunately, conflicts are there, but we need to prioritize health in the conflict, and that's the main message. Thank you very much, and take care of yourself. Enjoy the rest of the conference.